Hey guys, welcome back to DOCSHAALA, and in this series of videos of case-based scenarios, we are now going to see about Plaque Index from the subject Community Dentistry, and this is Dr. Janavi. Let's just begin with our topic. So, Plaque Index. So, I think most of you know what is plaque, right? Do you? It is a non-mineralized tissue that is found on the tooth surface. Okay. So it is described by Silnes P and Loh in 1964. So this is important. So it measures the thickness of plaque on gingival third. So when we are coming to our tooth, so this is the gingival third, right? So it provides good validity and reliability, and the drawback is that subjectivity is in estimating the amount of plaque. So the drawback is the subjectivity in estimating the amount of plaque. It sure measures the thickness of plaque on gingival third, but the amount is not measured in this index. So it is useful as a full mouth index and also as simplified index. So the teeth which we use to measure these plaque indexes, of course we cannot use all the teeth, but of course we have a index which measures plaque on all the teeth, right? Periodontal index, we sometimes take every tooth on the in the uh, mouth, right? But in plaque index we have index teeth. So when coming to the maxilla, we have, as we can see in the image, 1 6 1 2 and 2 4. Okay, so we take one molar, one incisor, lateral incisor, and one premolar. Okay, the same way when coming to mandible, we take 3 6 3 2 and 4 4. Okay, the same thing, one molar, one lateral incisor, and one premolar. Okay, so what are the areas that we examine? So we examine distofacial surface. So when coming to this tooth, this is distofacial surface. We examine the facial surface, we examine the mesiofacial surface, and we also examine the lingual surface. So distofacial surface is this thing, right? We don't go beyond this. Okay, so these are the areas which are examined. Then coming to the scoring criteria, so we give 0 for no plaque. If we observe no plaque, we give 0, and we give 1 for a film of plaque adhering to the free gingival margin and adjacent area of the tooth. The plaque may be seen in situ only after application of disclosing solution or by using the probe on the tooth surface. So this plaque cannot be seen with naked eye. It can only be felt with the probe or can be seen when we have applied a disclosing solution. Then we give score 2 when there is moderate accumulation of plaque of soft deposits within the gingival pocket. Okay, so gingival pocket is there, or the tooth and the gingival margin, which can be seen with the naked eye. So we give 2 when we can see the plaque accumulation with naked eye. Then we give score 3 when there are abundance of soft matter within the pocket. So gingival pocket or on the tooth surface and the gingival margin. That everything we observe only on the gingival third. We don't go beyond that. Okay. And one more thing you should keep in mind are missing teeth are not substituted. So when we have took some index teeth, right? So in those index teeth, if any teeth is missing, we don't substitute those teeth. Okay. So plaque index for a tooth. So if you are calculating plaque index for a tooth, we determine scores of all the 4 areas divided by 4. Okay, and plaque index for an individual, that is for one patient, we take all the scores divided by number of teeth examined. Okay, so this is the thing. And plaque index for a group, so we determine the total score of all the surfaces by number of individuals. So this is how we determine the plaque index. Then once we do the plaque index, how we determine those results? So plaque index is determined excellent when we are getting a score of 0. Okay, it is good when the plaque index lies between 0.1 to 0.9. It is fair if it lies between 1 to 1.9, and it is poor if it lies between 2 to 3. Okay, this is also important. You should remember this. Okay, so let's come to a clinical scenario now. So a patient comes to you with a buildup of soft deposits within the gingival pockets of his teeth. You also observe the spread of the deposits on the marginal gingival tissues. The entire dentition is immensely affected. You are required to score this accumulation of soft deposits according to the criteria established by Silness and Lowe in 1964. The following code can be assigned. Okay, he did not give any of the index teeth, anything. He just gave you one small hint, that is, observe the spread of deposits on marginal gingival tissues built up in gingival pockets. The entire dentition is immensely affected. So when the entire dentition is immensely affected, and that can be seen with the naked eye, and also you can see deposits on all the surfaces in such a huge manner, then we'll go for the upper limit. Okay, so the upper limit for plaque index is 3, right? So it is a very poor hygiene that is maintained by this patient. So the answer will be D, that is 3. Okay, so if you like our video, do subscribe to our YouTube channel and do like and share our video also. You can also follow us on Instagram at DOCSHAALA for dental content and at DOCSHAALA medical for medical content, and you can also follow us on Telegram. Thank you.